Yeah, good morning, Dr. Naveen.
Good morning, good morning.
How are you?
All well, all well. Thank you.
Okay, so shall we start the session?
Yes, please.
Okay, so dear participants, welcome back for the next session. We have our another expert, Dr. Naveen Sharma. Dr. Naveen Sharma is a senior scientist at CSIR Center Scientific Insurance Organization, Chandigarh, recognized for his extensive expertise in research and development. He holds a BTech and MTech in Information Technology from AVV, Indian Institute of Information Technology and Management, Gwalior. He earned PhD in Engineering from Academy of Scientific and Innovative Research, ACSIR, with over 14 plus years of experience across leading software multinational companies like KPIT, PCS, and prestigious government research institutions like CDEC, CSIR. Dr. Sharma has developed specialized expertise in computer vision, machine learning, biomedical imaging, visual thermal and terahertz, and cyber forensics. His diverse technical background underscore a strong foundation in cutting-edge technology and their practical applications. Till date, he has successfully completed and undergoing 10 research projects worth approximately 8.5 crore. So with this introduction, I invite Dr. Naveen Sharma for delivering his talk. Over to you.
Thank you, Dr. Abhishek, for the nice introduction. And I hope that I'm audible to the audience.
Yeah, it's
Am I, or how about my PPT? Whether it
yeah,
is visible?
it's there.
Yes, there. So, good morning, everyone. Uh, I was told, or I am known to this, that audience are from the diverse field. So, I have tried to make my presentation in such a way where we can get all the stakeholders at the same table. Okay. So shall I start? Can somebody from audience say yes, no, so that I will be known that somebody is there? Anyone from audience?
Yeah, in the comment box, Smriti Misra is saying yes.
Okay, okay, fine.
Amit Chavan is saying yes.
Thank you so much. So see, as we know that this topic is very new, especially for the medical research. Uh, I'm getting some noise. Dr. Abhishek,
Um,
can you mute the other audio?
I'm seeing like participants are requested to mute themselves. I think, yeah, I think
Okay,
all are muted.
thank you so much. Thank you. So, I was telling that this terahertz imaging is very new to this, especially for the biomedical applications. So, we at CSI Chandigarh, we have started this new dimension here in our division. So, what will be the takeaway from this presentation? Is first thing is to understand the purpose of terahertz imaging in diagnostic medical devices, and then once I will be completing this session, I will try to give a complete insight of a life cycle of developing a biomedical device project from concept to execution. So this will be the content of the presentations where I'm going to introduce the problem and then diagnostic different modality for that particular problems. And then finally, I'm going to introduce what terahertz imaging is and what is the how it interacts with the skin, what are the architectures, what is the process for acquisition of the things, and then finally, I'm going to come to the last but very important part, that is end-to-end implementation of a biomedical project and the way forward. So, problem statements is, as you can see here, just looking at that slide, you can see the statistic of diabetic across the globe. This is the data taken from the International Diabetic Federation 2025 reports. So you can see there, while we go this, if I calculate this, so look at the patient or the inflow increase. Look at the South Asia. In South Asia, there will be almost 73% increase. Like in 2024, the total number of patients are 106 million, and it is going to increase by 73%. So this is the intensity for this diabetic problem in India as well as across the globe. So what burden of the diabetic complications? So we can see, while we say that that particular person or that particular subject is diagnosed with diabetes, so there are lots of complications which is happening here. Like one we can count on is the diabetic retinopathy, sorry, which affects our vision, and the blindness can lead to the blindness. Then there is a stroke. Stroke increases the risk of paralysis or the brain damage. And then there is a diabetic cardiomyopathy, which weakens the heart muscles, and there is a high chances of heart failures. And then diabetic nephropathy, it is a kidney related disease, is generated because of this diabetic complication. And then there is a peripheral artery disease, because of which the blood flow decreases, and it delays the wound healings and the tissue deaths. And there is a neuropathy where the nerve got damaged and lost. Because of that, there are another complications arise. And then finally is the diabetic foot. So our focus will be only on this part. We are not going to touch upon all these diseases. So focus will be on this diabetic foot only. So what is diabetic foot ulcers? See, this is one of the most complicated cause of this diabetes. It arises because of these two main conditions. One is the PAD, that is the peripheral artery diseases, where the blood flow decreases within those blood muscles. And then the second one is the neuropathy, because of which the nerve got damaged, and as the nerve got damaged, loss of sensation got lost, and that injury got unnoticed. Because of these effects, what happens is there become a skin got breakdown, and this is called diabetic foot ulcer. Okay, so why I said that this is the most complicated complication of important complication of diabetic is, you can see here, every 30 seconds a patient with diabetes required an amputation across the globe, and almost 70% of the all amputation are caused by the diabetic foot ulcer. So see the severity of this. And we say that more than 50% or half of the diabetic foot affected got infected. All the ulcers which is there got infected, and those who have the ulcers, the statistics says that 70% of the amputated DFU patients will die within 5 years. So this data is taken from the wound care study. So you can see the severity of this particular disease, and I'm very sure that our near and dears nearby, they one or two people are affected with the diabetes. So what is the current diagnostic techniques for this diabetic foot ulcers? First one is the taking the medical history and physical examination as doctors do at their clinics. Then there are laboratory tested. There are many tested. There is a PAD testing is there, sensation testing are there, which is called the filament testing. So there are many other laboratories tested. And then the third one is the non-contact methods. So in non-contact methods, our focus is mostly the imaging part, imaging based non-contact solutions we are working on. So coming to this, first one is while we take images through RGB images or visual images, this is the ulcer, and based on that we apply certain level of machine learning algorithms, and we diagnose the cause. Second one is the thermal imaging. Based upon thermal imaging, we can detect the what thermal imaging do is, uh, thermal imaging basically assess the uh, temperature profile of the human skin. So wherever there is abnormalities, temperature variation will be different than the contralateral part. Then the third one is the terahertz imaging, which is very new, and I'm very, to the best of my knowledge, this is the first time in India the technology has come, and this is in our lab, which we recently have got this technology. So we have started this. So coming to the limitation of the existing diagnostic methods, the first coming to this RGB images. So as I said, this RGB images, it capture only the surface colors and the textures, not the internal tissue states. So because of this, it can't tell the what is the, it is insensitive to the hydration and the blood flow inside the skin and the light, and it affects the lightening and skin tone variation. The accuracy will affect because of these things. And again, detect the ulcer only after the visible damage happens. So this, using these techniques, we can diagnose the things only while the ulcer is visible at the surface level. So you can see there are multiple papers for this to diagnose these tech using these techniques. Okay, but as I said, the drawback is we can see only that ulcer happened to the skin level. Now coming to the another techniques, that is called thermal imaging. For the audience who are not aware of, familiar with the thermal imaging, we have intensively worked for 5 years in the thermal imaging and have published many publications with the collaboration of PGI-MER Chandigarh. It is one of the largest tertiary hospital in North India. So, and we have examined almost 200-300 patients there. So while looking at this, what thermal imaging does is, it analyzes the surface temperature of a skin, and based on the abnormalities, as I said, it will take. But the limitation is, first thing is, it can only analyze the surface temperature, not the beneath surface. Second thing is, it is influenced by the ambient conditions, which I will tell you in details in the later stage of the project. And the patient postures also will affect. And it can give false positive due to the external heat or inflammation. Means if the ambient condition is not suitable, if the ambient condition is variable, that time also this result will affect. So it does not allow early prediction of diabetic foot ulcer. So this is one of the paper which we have published in 2024, where I will tell this particular project in details in the last slides. So now coming to the main part of this is the introduction of terahertz imaging. Terahertz imaging, if I see the electromagnetic spectra, so it lies between the microwaves and the infrared radiation. So this lie here in the middle of this. So you can see the application is vast for this terahertz imaging in anywhere, like including the food industry to the communication, packaging and inspection, arts, conversation, military, many, and medical imaging, quality control, spectroscopy. So those are the applications where terahertz is used. But our focus will be on the medical imaging only, where this has intensively used in the in vitro and in vivo both condition. It has been used for the breast cancer, for many causes, for dental caries detection, cornea detection, so brain carcinoma, skin carcinoma. So there are plenty of applications where it has been used. But in India, we, especially for the imaging part, spectroscopy part, there are certain research where they are doing well. But in terahertz imaging, there are hardly any people working here for this cause. So why we have chosen this, why we are calling it advanced technology, advanced imaging technology? The main reason for this is, first one is it is a safe, though thermal imaging is also safe and non-destructive, but the good part is it is highly sensitive to the water content and it has a property. The good thing is it has a property. It can do the analysis at the subsurface level up to 0.3 mm it, of the penetration beneath the skin. It can analyze the hydration level. So hydrogen bond breaking and formation affect the molecular vibration and rotation, and these are the things which is measured through this terahertz imaging. So you can see the classification of the blood this hydration in our human body. So you can say the 75% of the brain, 83% of the bloods, 79% of the hearts, bones, muscles, liver, and all. So they all are the composition of blood. This hydration. So if we can detect these parts, so many things can be diagnosed at the very early stage. So how this interaction happen is, so this is our, if I take a view of our skin or the layers of the human, this, so you can see that this is the epidermal layer, then dermal layer, then a hypodermy. These are the, if you take any part of the human skins, so this is the layer by layer through. So penetrations for what we do, this terahertz interaction, how it interact with the skin is, this is the source, where the source we get a radiations, and then this is the detector, which detect this, all those effects, which I was telling earlier. And then finally we get this image. Based upon that, this image tells the hydration variation beneath that foot. So system architecture or setup of this terahertz imaging, on the basis of setup configuration, it is divided into two parts. One is transmission mode, where sample is kept in between the detector and the source. Okay, so this technique is used where penetration is possible within that particular layer. However, it is not suitable for a human skin because due to that high hydration level in the human skin, penetration is not possible. It absorbs all the radiation from this terahertz. Sorry. So there is another mode which is called reflection mode imaging. This is what we are doing here. In the reflection mode, it reflects back from this sample surface or the subsurface layer. It is ideal for the opaque or thick samples such as the biological tissues and the skin, and it captures the interference reflections and gives the depth resolution of the structural and hydration data. It is so reflection mode is commonly used for the biomedical application. Transmission can be used for many other applications. And then the classification based upon the source emission. So it is also again divided into two parts. One is the pulsed terahertz imaging. So in the what happens in pulsed terahertz imaging, it uses the ultra short terahertz pulses containing wide frequency spectrum. So there is not a single frequency, there is a wide frequency. It captures both. This is very important, amplitude and the phase, and provide the time flight and depth information. Okay, so this is very important. So it helps in the 3D imaging and spectroscopy. As I said, many people are working on this. And there is another is the continuous waves terahertz imaging, which use single fixed frequency terasource, and it measures only the amplitude or the intensity of the transmitted or reflected waves. It is suitable for the 2D imaging and the real-time monitoring of the applications. Like I said that this is a complex one, but it is a simpler because it takes a 2D image and those images we can analyze. Please let me know if I'm going very fast or if anybody have any doubt as of now. Shall I go ahead?
Yes, sir, please. The pace is nice.
Thank you. Thank you so much. So now coming to the how image acquisition is done and how it is processed, these terahertz images. So as we know that field of view is FOV is nothing but a field of view. Field of view is very small in case of terahertz imaging. The system which we have acquired recently have a field of view of 4.5 into 4.5 centimeter only. So because of this lower terahertz resolution, the challenges are there. So this is the source. So this is the detector. Oh, this is a source, and this is a detector. As I said, the field of view is very less. So we get a small image patches. So if we want to cover an entire foot, as our application right now is diabetic foot, so we need to access the entire foot. So we will get a limited patches. Those patches is collected, and like here, you can see here, this through this motorized stage, we get such patches, and finally we get the complete image using certain level of machine learning or deep learning algorithm. We get the complete images, and once we have this complete foot image, complete region of interest, we have developed the software which analyze those images and finally give the results. So what parameters we looked while analyzing those images? So these are the green one, the parameters which we are assessing right now. Rest other parts maybe because of that spectroscopic images or pulsed images. Those parameters is not possible to take from the continuous wave imaging system. So how we do this is first we get a raw terahertz image data set. Then those images got processed, pre-processed, and we extract those features, and then we trained our models, AI models, and finally we validate and do the corrections, and the classification map is classify whether the foot is normal or ulcerate. So for, like I was told that the audience is mixed, before going to that type of, like I said, that project which I am going to discuss in detail uh, as this topic ends. So I need a certain terms to get introduced to the audience, those who are not familiar with this term. So like I said, the machine learning is basically divided into three parts. One is the supervised, then unsupervised, and then there is a reinforcement learning. In supervised, we know the results, that those results are called labeled one. So we have the labeled data set. I will say this particular image is what this is. So in this case, we know the results and we tell that our model that, okay, this is the result, this is the input. So based upon that, models get trained and it gives, finally, while we test the data set, it will give the results. But in case of where we are not sure about the output or the outcome, where we cannot label the data set, we used unsupervised learning. And then there is a third part which is called reinforcement learning. It is a agent-based learning where agents or the weights will decide, okay, whatever is the output method, that output is okay for us to our requirement, or it needs certain correction. So that agent will tell the correction, and based upon those correction, it will retrain the model. So these are the brief overview of the machine learning models. So everybody should be aware of these three terms: what is supervised, unsupervised, and the reinforcement learning. So for our application, we have used supervised learning because we have the labeled data set here. So in supervised learning, like I said, that we got the input image, then we extracted the features based upon this, then generated the feature vector, and then finally we applied the classifiers. Though these are the conventional classifiers, we can use for the other classifiers also. So once we have trained the model, we can easily test the unknown images and based upon that, it will predict the results. So previous case study, there are only whatever we could research over the years, we could find only this group. This group is working on this terahertz imaging part for this particular cause. It is based on the Mexico University. So they have published certain statistic for that. They did the analysis using terahertz imaging. So this is the setup. This is the, like I was telling, the source and detector. And through this, they have analyzed the total 38 diabetic patients and 33 controlled. Control means those patients, those persons who are not affected with the disease. And so they have given the results based upon the findings. They divided. They could find the results. Those suffering with the diabetic foot, they have a hydration level lower than 44% of the total volume. And in the control subjects, it is increasing. It is above 55 to 66%. These are the threshold they could decide based upon the experiments. Then there is another statistics where they classify the based upon the different zones. Like I said, what is the hydration level? They just give pixel by variation. They have given this for the RGB parts. Then in this study, those hydration level, they have given the pseudo colors, and so that they can easily analyze or monitor the wherever, like you can see there, this particular zone is where the subjects have a healthy fit, and this is the where it is a diabetic fit. So this is the only studies are done across the globe. Not yet. Here we have started. So these are the more results from the same authors. So what is the advantage and the limitation? So what is the advantage? Advantage, as I said, this is non-ionized and safe imaging. It is sensitive to the water content. Hence, it can detect many causes in a human skin or beneath the skin. And very important thing, it has a certain level of penetration capabilities, which is not in the thermal imaging or the visual imaging. Okay, so like I said, it do the surface as well as the surface imaging, and it analyze the highly contrast to the biological tissues. Okay, and while using the multimodality, their applications are vast. Like it can be used for the skin cancer detection. It has already been used for the skin cancer detection. Transdermal drug delivery system, it has already used. Then scanner and wound assessment, which my application is focused. It is vast application. So limitation is again like any other imaging modality. This has also the limitation of penetration depth. Only a few hundred micrometers in the biological tissue due to the high water absorption capabilities. So penetration depth is one of the limitation. Certain level it is a complex and sensitive to the environment, as I said, and low imaging speed because, as I said, field of view is very less. To capture the particular region of interest, we need to take the multiple images. Okay, and still it is in a research phase, but high potential. Scope, future scope is the portable terahertz imaging system. As I said, that report this, it has terahertz is selected as one of the 10 emerging technologies that will change the world. This is the report from the MIT. So this is the application which I said that. So it is evolving technology, but scope is like we are talking about the 6G and all. This it has a vast application in that. So first part I have already finished. That was the terahertz imaging and its application in biomedical research. As of now, if any audience have any doubt, any things they want to ask, they can ask, so that I will switch to the other part of the project. Anyone? Any
Yes, sir.
questions?
I do have a query. Uh,
Yes, please.
in your research paper, which you have just shown, uh, you have implemented a few machine learning algorithms
Right.
on the curated data set,
Actually,
and post that.
just a second. This is not my
Mhm.
result. This
Okay.
is the as I said, we have just recently got the application, this setup here in India, hardly 2 weeks
Mhm.
back. These are the results published by Mexico University or 2 years back.
Okay. Okay, sir.
Yes.
Then no, I don't have any query now.
So I will be
Thank you.
coming to the part where we have done the study. Those part I want to cover in that next segment of our this presentation. Yeah, still you can ask a question. Means like
No, my query was just applying. My intention to ask is this one, just applying a blindly few set of machine learning algorithm. Um, it would be highly sensitive in the field of medical diagnosis and disease detection, isn't it? So, what kind of preventive measures took or implemented in this particular research? Any explainable AI concept or responsible AI,
yes, yes, yes,
such
yes,
kind of
yes.
thing?
That was the only things which I thought of to, though this was not a part of this particular presentation, but deliberately I put this one here so that you will get to know what are the things which we should be taking care of while implementing a biomedical research project, and again using AI part. Okay. So I will be coming on
Okay,
to
sir.
this. Right? Anyone else?
Okay, sir.
Shall I go ahead? Yeah, so
Yes,
if
sir.
no questions, so I will go ahead. So I don't know how many of you are working directly to this particular in the field of biomedical research. Yeah, still those are there in the they will be that benefited highly, but those who are not in the exact to the biomedical field but are doing a research project, they will also get some insight. Okay, to taking care of those things. So the complete life cycle is first thing first, while we start the biomedical project or any project, we need to identify the problem is the very first step for anything. And in the addition in the biomedical research is the ethical approval, which is very, very important. Even though you develop anything in lab, if it is not, if you have not taken the ethical clearance from the concerned uh, agency or concerned software, concerned hospital, that project doesn't mean anything to this biomedical research. Once we have the problem, we need to design the study and the data acquisition protocol, where we include the inclusion and exclusion criteria, how data is going to collect, what all the protocols is going to be followed up. So these are very, very important. If you miss these particular things, there are high chances you will end up to getting anything at the end of this project. Then third portion is the pre-processing and data labeling. Data labeling plays one of the crucial role while developing any biomedical projects, because if you are not giving a proper labeled data set to any uh, machine learning models, it has no meaning. Because as we know, if you for a particular mobile phone, if I tell my model that this is not a mobile phone, this is a animal, it will always recognize it as an animal. So that is the difference between the human brain and the AI model. Okay, it learns whatever we tell to it. Okay, so data labeling play a very crucial role, and this has to be labeled by the expert. It is not that you are labeling it your, especially for the medical application, right? Then once you have labeled this, once you have completed these three parts, your lives become very easy. Then anybody nowadays, you don't even need to those models, you can extract those features. There are already available models there, and you can train the models. However, once you get the results part, validation and clinical correlation is very, very important. If I am saying my accuracy is 100%, that doesn't mean anything if it is not correlating to the clinical research. Right? And then final is the translation and future scope, where we translate those particular application to there. So this is the complete life cycle of this. Now coming to the case study, which I introduced earlier. As I said that since last 5 years, we were extensively working in the part of thermal imaging, where we have taken the application mostly for this diabetic foot ulcer. So taking this case, as I said, what is the first part is the identification of the problem. So problem statement is for this particular problem is developing a non-contact technique to assess the ulceration condition of in a diabetic foot patient, right? So this is our problem statement. Why I have chosen most of the things I have told earlier. See, current things, if I am using thermal imaging, mostly either it's a manual things or it is semi-automated assessment. So while we do, this is the hospital images, this is the real images. So this is the real condition of the diabetic foot ulcer. That is what I was telling you, why, how sensitive it is. And still in doctors assess like this, using this measuring tape and all, they will get the dimension of this, and based upon this, they will say that whether that ulcer is getting healed or not. Why this problem is so complicated? Because see, once ulcer is there, our job is to detect the pre-ulceration condition. However, if ulcer is there, it takes lots of time to get healed because of this diabetes. Why? In case of a person is suffering from the diabetes, healing process delay. The reason I have already mentioned, because of low blood flow, low blood circulation. If blood circulation is less, oxygenation will be less to the tissues, and tissues start get dying. So healing process take lots of time. So this is the current status. So our target was to automate these things. So this is the manual things. This is the semi-automated. Here again, these things need to be selected by a particular clinician or nurses, which is there is again the user error. Error part is always there. So this was the problem statement, and why we want to go for this. This is the statement. So we all are clear about the first part of our project, which I was telling in the life cycle of the implementation of the project. Now, second thing is the study protocols. So in the study protocols, like I said, the protocols need to be approved by the research ethics committee of that particular institute, wherever you are going to take the data from the subject. Then in that protocols, there is an inclusion criteria. Though for your reference, I'm just giving you the example that it can be for any disease, but it is similar to that. Okay, and here I'm taking the example of diabetic foot ulcer. While we wanted to take the data set of the diabetic foot ulcer, so this was the inclusion criteria. Okay, so what are the subjects? Subjects is a male or female, aged above 18. They are type 1, type 2 diabetes. Subject with diagnosed with a neuropathy, we consider this one. Subject should have adequate vascular perfusion. Blood flow should be proper. So we did this testing, ABI testing is there, and presence of at least one TFU. So this were our inclusion criteria. Then similarly, exclusion criteria, we excluded all those subjects where there is those ulcers are infected. Ulcers are there. Subject with more than 3 ulcers below the knee, we excluded those subjects. Subject has ulcer caused by disease other than diabetes. A subject with gangrenous or ischemic ulcer, we have excluded. See, why I am telling these terms is, if you are not putting this condition, see, So that ulcer may be because of any other cause. So your AI model will never give a correct results to that particular problem. So you should be very particular to your exclusion and inclusion criteria, right? So I have given few, though protocols are very vast, very big. For exclusion, there are detailed exclusion there, detailed inclusion is there, right? Now, once we have this defined the protocols, what are the patients which we are going to take for the data acquisition, what are the subjects, which patient or subject I am using alternatively for the same name. Okay, if I am saying subject, that means patient I am talking about. So subject, once we have defined the proper protocols, we have got the ethical clearance. The third part is the data acquisition. So data acquisition also, that particular MBA scenario or that particular place should be properly, we need to define the, we have that the 2 feet distance should be between the subject and the camera, which I am going to share here. So this was our actual setup. So distance between the feet and the data acquisition setup is fixed to 2 meters, right? And then all trials were conducted in the control environment where the temperature was kept between, this is a mistake, there's a degree, 18 to 23 degrees Celsius. And observation area was protected from the outside information, and minimum 15 minutes of stabilization time was there. So suppose if you don't have these protocols, or if you don't have the protocol which I have mentioned earlier, and you are taking data without consideration of all those things, your AI model will not give any good results. So if you are following proper results, if you are following proper protocols, so these are the things which makes AI, usage of AI different in medical things than any other applications. Okay. Now the fourth step is the data acquisition setups. Like I said, this is a real setup which we used there, and this is the real images which we took. The thermal images through using this thermal imaging camera. So you can see here, this is the scale of temperature here. So whitish one is the highest temperature. So those are less affected, temperature is low. But at the ulceration level, you can see the temperature is highest. So this way we took a data set of 104 patients where there were 71 patients with diabetic foot ulcer, and then there are other 33 non-diabetic or control subjects. So this was the representation. This is how we got a thermal image in the pre-processed one. So pre-processing step is very important. So when the temperature, so why pre-processing step is very important? This is here, I can see here. Like I said, that thermal imaging, through thermal imaging, we assess only the thermal profile of particular region of interest. So you see where there is a difference between the ambient temperature and the region of interest, you can get a clear image. However, there are certain, look at this image. This foot has a similar temperature than the like the ambient temperature. So here you cannot get even this image. So how to do this? So pre-processing become a very important part. So here, if we want to do the contralateral analysis, means if we want to compare this put to this put, we need this put here. So this way you do the pre-processing and we get the pre-processed image for final analysis. So this is the pre-processed image. Earlier this image was like this. So that is what pre-processing become important. So then you need to define the baseline characteristic. So this was the baseline characteristic of my entire data set. Total patients was 104, and then there was female ratio, male ratio, likewise. So these are all the parameters. So why I am telling these all parameters, you can see the intensity of the project criticality. then only you can say that the developed application is medically qualified. If you are not taking care of these parameters, your device, whatever algorithm you use, this will never get the this clinical clearance. It will never get the clinical clearance. They will ask all these questions. So this was the things which we did before starting this project.
Sorry to interrupt you, sir.
Yes, please.
Can you please move on to that slide?
Yes.
Yes. This slide denotes basically the stats about the data set. Am I right?
Right. Right.
Okay, okay. I thought some clinical ranges as per the medical diagnosis.
No. It is
Okay.
the things which we have acquired. So
Okay, okay, fine.
like here, this AS was almost on an average 54, but yeah, plus minus 7 years was the difference.
Okay.
So
Okay,
similarly for
got
the
it.
BMI, whatever data set for this all 104 patients, BMI was in this range. Okay. And these are the subject static was almost out of this 104 patient, 19% were the subject they used to smoke, alcoholic kind of. So this is the statistic of my data set which we have taken.
This is
Is it
quite
clear
a
to you?
yes. This is quite a significant statistical analysis which has come out of the study as well. This again might further help the clinicians
Yes,
evolve.
yes, ma'am. Yes. Very right, ma'am. So that was what why I am telling all these parameters is so that those who really working in this particular types of field, they will have that idea. Okay, how critical is that biomedical project? So this was the proof of concept which we did before starting the project. So here you can see that wherever the ulcer is there, temperature is high as compared to the other part of the skin. You can see that. So based upon this, we could first. So before starting this, defining the problem, you first have the idea, okay, whether this technology, whether this technique is going to work or not. For that, we do the proof of concept first. So now severity analysis. So the objective was where we want to analyze the severity if the foot is affected with the diabetic foot ulcer. So what portion severity of that portion need to be analyzed. So for that, we took a foot image, we did the pre-processing, then we divided the entire foot into three parts: forefoot, midfoot, and infoot. And based upon this, we label that data got labeled. We extracted the features, applied this. Based upon that, even this is the first time which we did here in India, not in across. Nobody has done this level of severity analysis. As of now, the research can only tell whether there is ulcer or not in the foot. But our research tells, okay, what portion of the foot is, how much severity is there. So these are the results. But for getting these things, like I said, that this is the pre-processing which we did. We removed the background noise and all. Finally, the region formation, we divided the entire region into three parts, okay, based upon the anatomical conditions. And then severity got labeled. This is the labeled by the clinician, not labeled by us. So labeling was done based upon these analysis. So what here we did is coming to this part. So if this is a right foot and left foot, because we wanted to do the contralateral analysis, means we want to compare the features of the left foot to the right foot. So if the difference is less than 2.2 degree, delta difference is less than 1.2 degree, we consider it as a normal region. If the difference lies between 1.2 degree to 2.2 degree, it is considered as moderate. And if the difference is greater than 2.2 degree, it is considered as a severe. Means there are highly chances that that ulcer is going to happen or ulcer is already there. So feature extraction, I will not go detail in this. These are the feature extraction techniques, which these are the parameters which we got from this. And based upon this, we used both conventional machine learning models, okay, and the deep learning models, because our motive was to see, okay, if I am using the deep learning models, how the accuracy got affected. So this was the evaluation matrix where we analyze the accuracy, precision, recalls, and F score. So while I focus on the conventional machine learning models, these are the models which we analyze, and we, based upon that accuracy, we could get measure accuracy to this random forest. Then coming to this deep learning models, these are the models which we use. I'm not going detail in this because the motive here is not to explain these models, because I assume or I expect that many of the previous speakers might have told about the deep learning models, deep learning architecture. If not, in the upcoming lectures also, there might be definitely going to cover this. So my motive here is how this medical project is implemented. So this way, we analyze the ROC curve, where we can say that how a particular model is accurately classifying the disease. So performance was compared. So while we applied the conventional machine learning models with the deep learning models, you can see here accuracy got drastically increased from 83 to 92%, even though there was a limited data set. Then there was, so the first objective was to detect the pre-ulceration or ulceration condition. Now the second objective was here for this project was, if that ulcer is there, can we detect the healing trajectory, whether that ulcer is getting healed or not. For that, because why this is important is, suppose that person is getting therapy, but doctor is not able to detect whether that therapy is going in right direction or not. So we automated the process, and we followed a particular patient, particular ulcer for 8 weeks. 8 weeks in a non interval manners, like for first week, that is the 0th week, second week, third week, fourth week. After fourth week, the fifth week is after gap of 2 weeks. Then the sixth week is after gap of 3 weeks. So likewise, total 8 weeks we followed up the particular heel ulcer, and this was the result. So this is the ground truth, and this is our result. So based upon that, our result is highly correlating to the gold standard results, and it tells whether that ulcer is getting healed or not. So these are the results where there is at certain level, even that the 9th week, that ulcer was not getting healed, and so that may, even in the very stage, doctor came to know that that therapy need to be changed, and so that it will be. So this helps a doctor or clinician, okay, whether that therapy which they are using is good for that particular ulcer, or they need to change the parameter. So this was the overall things. I think you have got the glimpse of and the criticality of the biomedical projects. Or if you want to, if you are like, this is has become a passion that we are using. Everybody want to use that AI models. However, we must know what is inside, what all the things need to be taken care for the data set. Then only our this model will give the correct results. So coming to the last slide, this is a way forward. Way forward is what lagging here is the collaboration between the medical and the technical institutions. This is very, very important. Here we in CSIO, we have a very good connect with the medical. So whenever we start our medical project, from the day one, we include at least one doctor for that particular fields. So we must need to stop working in the silos, remove the firewall between the clinical load and hope for IPR. So because many companies, what they do is, once they develop the device, they will file the IPR, and then they will try to protect. So in clinical way perspective, we need to be a little bit liberal for this. Government funding must be increased in this. As we know, there are hardly support for scientific research, especially for the healthcare. Though after COVID, there are slight increase in the fundings, but still, yeah, new scientific and clinical findings should be shared through open source. As I said in the past point, silos should not be there. Integration and interoperability, including the ethical, legal, and logistical concerns, are enormous. If we remove these things, this will become very easy. So that's it from my side. Whatever was the allocated time, I think I am on time, and I look forward if anybody get any doubt or you can ask. So that's it from my side. Yes, thank you very much.
Any question from the participant side?
Any question, if anybody want to ask anything, or I don't know the audience very much, so I'm open to ask, or you can contact me for any future collaboration or future discussion through this. Yes.
We would definitely.
Sure.
I'm Dr. Shiva, and that's a very comprehensive and good research that you've done with the limited resources that you have. But one thing which you brought out very correctly is that the collaboration between doctors and the scientists who are doing it, and we look forward to and give our assistance to working on these kind of projects with our inputs, which would probably help in clinical outcomes as well. So thank you for that.
Thank you very much, ma'am. Thank you.
Naveen, sir, I do have one more query. Uh, One thing which you have already offered for the collaboration, but I want to know that ethical clearance, specifically for model validation and deployment, is very difficult to get that one.
Right.
So, can you please highlight some key points or key factors which we need to clear?
So ethical clearance. Are you from the medical fraternity or you are from the technical side?
No, technical computer science only, but my
Okay.
research domain is infectious disease only.
Okay, nice. So my answer to this is, like I said, here in CSIO, whenever we start a project, biomedical project, we include at least one doctor. So getting ethical clearance is very tough, especially from the hospitals, because for us as a technical person, it become very tough to make them understand the technical points, and for their point of view, it become very tough for us to understand the medical terms. So if you have a good doctors, helpful doctors, so in collaboration with he or she, you can easily tackle those situations. If you want to go solely to get the ethical clearance without the guidance of the medical experts, it become little tough. This is my experience. Maybe it may not be valid for many other reasons. But to be frank, my experience was that, like earlier, we used to go try alone, thinking of that we are the best researcher. But see, for perspective of the medical fraternity is different than the others. They don't believe in the how much accuracy, what best technology you are thinking. They're more concerned about whether it is safe for a particular subject or not, whether this particular device is safe. So safety is the one of the major concern. Okay. So it will be helpful if you connect with the with any medical expert from the very beginning. I hope I am clear to you.
Yes,
Okay,
sir.
any other
But
queries
the
from the
problem,
participants? Yeah, please.
my query was, sir, that somehow I got that data clearance and I got the data. But and I have trained my model as well. I'm getting better results as well.
You are looking for the model validation. Okay. Got it. Model
Yes,
deployment
sir.
and validation. So validation, you are saying
Exactly.
that whether your model is correct or not, right?
Real-time
You want
validation
to
we
know
need.
that, right?
Exactly, sir.
So for that, that is what in the initial stage, I think in some of my slides I have shown, I have mentioned. See, the first thing is the labeling is very important, whether you have labeled through the proper clinician. Then the second thing is validation can be done in a two way. One is if you have already in place a gold standard devices there, which is which is there in the market and which give, let's say for example, if I am developing a blood pressure monitoring machine. So one technique which I have developed, second technique is already there. So this way you can validate with the already established device server setup there. The second step is if there is no any gold standard there. So then only option left with you is the clinical validation. Like we did is, so suppose for one of our another project, there was no clinical, no, there was no any gold standard device for validation. So what we have to do is we have to do only the clinical validation. Means whatever results your model is telling, you need to verify with the clinicians finding. Let's say if you say, okay, this particular disease in that particular region of interest, this is the disease from our clinical parameters. That may be assessment of clinical assessment and testing, and similarly your results. If it is validating, if it is supporting to this is what I was showing, that healing trajectory. So in that, one is the gold standard device, another is the our results. So this way you can validate, right? And then there another thing is you have a certain for certain parameters there is an NAVL accredited agencies where you can validate the parameters.
Okay,
I
sir.
hope
Got it.
I'm clear to you.
Yes,
Yeah,
sir. Thank you.
yeah. Anyone else?
So I have also one query, Dr. Naveen.
Yes, please.
So like you were explaining the terahertz imaging for the biomedical applications. So can you tell us like terahertz imaging can be used what type of applications where the other imagings are not useful, or should I say like this, like what hidden truth can be exposed through the terahertz imaging where the conventional imaging are not able to do that?
Very good question. So just a second. I just want to show you this slide. Maybe it will get more clear to you. So I hope this one is visible, right?
Yeah, yeah.
So here, like I said that this RG through RGB images, the main problem with the RGB images is it you can analyze certain disease only when that is at the surface level. It is visible by the naked eyes. Okay.
Okay.
But and through the thermal images, you can assess the cause, because only if the inflammation or whatever cause is there, it is at the surface level. But all these non-contact images cannot assess the things which is not beneath the surface. I mean, we cannot do the subsurface level imaging. For that only this terahertz imaging is there, which do certain level of subsurface imaging.
Okay.
Yes. So that was the added advantage. Like I have shown here this limitation also, but other than this, I said here, you can see here all this whatever imaging techniques, like if I talk about the visible image and the thermal image, they will do only the surface level. But this terahertz imaging, they can do the subsurface level. They can penetrate up to the epidermal layers. And so let's say for the ulceration case, even if ulceration is happening, you can detect at the very early stage. So that stage will not come or where already ulcer is there. I hope I'm clear to you.
Yeah, please. Yeah, sure. Thank you. Thank you very much.
Thank
So,
you so much.
if there is any no more question, then on behalf of all the participants, I would like to thank you, Dr. Naveen Sharma, who has presented a new theme of imaging, that is a terahertz imaging for biomedical applications. So, thank you, Dr. Naveen. Thank you for delivering a nice lecture. Thank you.
Thank you so much, Dr. Abhishek, and thank you, audience. And feel free to contact me, as I said, for anything like for any collaboration or any discussion, please.
In
Thank you
fact,
very much.
Dr. Naveen is also part of our group. He is also co-convener of this workshop and part of that WhatsApp group. You can directly contact with him. So,
Thank,
thank you.
thank you, Dr. Abhishek, and thank you,
Welcome.
everyone. Bye bye. Have a nice day.
Okay, participants. So now we are closing this session and we'll get back to you at 2 p.m. Where Dr. Professor Manoj Kumar Gupta from Sri Mata Vaishno Devi University will deliver the practical session. So please attend the session at 2 o'clock. Just try to be connect with the 1:55 and then we'll start at sharp 2 o'clock. Thank you. Thank you all.